Thank you very much, and it is very important to be here this morning, and I welcome the opportunity of participating in this event once again. And can I pay a particular welcome to my colleague Minister White from the Department of Health in Dublin, and thank him for taking the time to join us this morning. Last year we had the event in Dublin, and actually there's a larger crowd here this year, which is good, because we need to be discussing with you and meeting with you and hearing what has to be said and seeking to respond. And it will not all be done in a few weeks or a few months or indeed a few years, but it is incrementally important that we keep doing things and getting them better all of the time, and we just need to keep working and working and working at it, and we can only make achievements by listening to the voices of the key stakeholders. And it's great to see so many key stakeholders here this morning. And as already been said, others cannot be with us for a variety of reasons who would love to be here, and our thoughts are with them this morning. I'd like to thank the organisers for inviting me to speak, and I would just like to say that we have met a number of people in the audience before, not least of course Christine Collins, the chairperson of Northern Ireland Rare Disease Partnership, and Alistair Kent from Rare Disease UK. As you will all be aware, the UK Strategy for Rare Diseases was published last November by the Department of Health in London after a UK-wide public consultation. Since then, all 4 UK administrations have been working to address the 51 commitments which were made in the strategy. In Northern Ireland, a specifically constituted rare diseases stakeholder group has been working to produce the Northern Ireland Rare Diseases Implementation Plan, which will serve as the basis for how we provide services for people with rare diseases in the years to come. The Northern Ireland Plan itself will not be ready until later this year, as it entails a substantial amount of work involving contributions from a very wide range of stakeholders covering a number of major issues. However, I would like to assure you that a draft framework document is nearing completion, which will provide a sound basis for the full plan. There's still much to be done to improve the lives of people with rare diseases, in terms of empowering those affected by rare diseases, identifying and preventing rare diseases, improving diagnosis and early interventions, better coordination of care, and supporting the role of research. We must, of course, acknowledge that Northern Ireland is a very small country, and that in treatment of many rare diseases, we will continue to look to our neighbours, and indeed further afield, for some of the specialist services which it is not practicable to provide here. But that is not to say that we are starting from scratch. In fact, much has already been achieved. Let me give you a few examples of what I mean. The Health and Social Care Board and the Public Health Agency, along with the regional genetic services, are currently working to develop a service specification for medical genetics. This will be a key element in developing several UK strategy commitments, particularly around referrals, standards, access and timeliness of genetic tests, managing familial genetic conditions, service models, and relationships with other interdependent services. Importantly, the Health and Social Care Board and Public Health Agency have identified rare diseases as a commissioning priority for the forthcoming financial year. Northern Ireland's Guidelines and Audit Implementation Network, GAIN, which is sponsored by my department and plays an important safety and quality improvement role in HSE services, by commissioning regional guidelines and audits and promoting good practice through dissemination of audit results, has supported the development of standards of care guidelines for Northern Ireland people with Duchenne muscular dystrophy. This is a very welcome development, as it will enable the board and the agency to begin work on examining the potential to replicate this successful template for other rare diseases. And of course, the Northern Ireland Rare Disease Partnership itself is mounting a living every day with rare disease engagement exercise to look at the reality of care and everyday life with a rare disease being run jointly with the Health and Social Care Board and the Public Health Agency. There is no doubt that there is a lot that we can feel positive about, but that does not mean that we should be complacent and forget that there is so much more to be done. I've mentioned this before, but I think it's worth repeating, that Northern Ireland is unique in the United Kingdom in that it shares a land border with another member state of the European Union. The accessibility of services in terms of distance, combined with the high standard of transport links, means it may be desirable in many instances to develop clinical networks with the Republic of Ireland, as well as wider networks with Great Britain to support sustainable service models in Northern Ireland. There's a need for flexibility of arrangements and collaboration where possible in the interests of patients. And I'm pleased to report that work is already underway between the two health departments and their respective commissioning organisations to explore ways in which cooperation to both our countries' mutual benefit can be taken forward. I understand that the Republic of Ireland's Department of Health plans to publish its own rare diseases plan in the near future, and I have no doubt that there will be a recognition of the North-South dimension as there will indeed be in the Northern Ireland plan. So ladies and gentlemen, I'd just like to finish by wishing you all a very productive and enjoyable conference today. Regrettably, I won't be able to stay for it, but I know that it will be something which is massively useful to my department, and my officials will be taking real learning from this to be applied in the days that lie ahead. Thank you once again.